Hello and welcome to the Cap Psych Pod. I'm Kristen Davey, Operations Manager here at Capital Psychological. Today we're joined by Brenda Weaver, who is our Practice Manager. Brenda has been with the clinic since 2015 and manages everything from intakes and payment to keeping the office running day to day. Brenda, thanks so much for joining us today.
Thanks for having me.
Today we'll be covering some frequently asked questions pertaining to taking the first steps in finding a therapist, information you may need to research before reaching out to a clinic or a therapist, and how to go about getting that first appointment booked. So the first question I have for you is, how do you suggest someone begins their journey to finding a therapist?
The first step is probably to talk to your GP, let them know your concerns, let them know what's going on with you. They may have a referral source for you. If they don't, just start doing your own research on therapists in your area. Ask friends and family if they have any recommendations. A good resource that I sometimes recommend is the Psychology Today website. There you can filter by location, specialty, in order to find a therapist that might be able to help. Some will note if they're accepting new clients or not.
Well, that's good. That's helpful. So you don't just randomly reach out to a bunch of people, and if they're not taking any people, it's not going to just waste your time.
Exactly. It's hard enough to take the first step without being turned down 100 times. Maybe not 100, but you know what I mean.
Just disheartening if you don't hear back from people.
Mm-hmm. It really is.
So when you do go about reaching out to people, what is some information that you should include in your initial message for them?
So what we need to know if you're looking for an assessment or if you're looking for therapy. We can touch on that a little bit more later. We need to know if you're looking for yourself or if it's for a family member. If it's for a child, we need to know the custody arrangements, if parents are together or not. If they are together, great. If not, then we need to know who has decision-making. It's just a good idea to come into this open book so everybody knows, everybody's on the same plate. We need to know if you're looking for a certain type of therapist. Registered psychotherapists, psychologists, social workers, there's so many different kinds. It's important to let us know if you are looking for a specific modality, CBT, DBT, something like that. And of course, we want to know the reasons that you want therapy. Give us as much information as possible so we can find the best therapist to suit your needs. We have to speak to the therapist to be sure that they can work with you on your concerns, but everything's confidential to the office and you don't have to worry about that at all.
Right. That's good. So just about the different modalities, typically, do you think that a GP, if they're referring you to a therapist, would they specify oh, I think EMDR would be helpful or CBT would be helpful or anything like that?
Sometimes they do, but sometimes they just say, you need talk therapy or whatever, which can be a bunch of different ones. So yeah, okay. Kind of depends.
Right. And I guess you can just kind of ask your therapist too once you are set up what they think would be the best.
Exactly. Yeah.
Okay, so touching on the therapy and assessment aspect, what's the difference between therapy or treatment and an assessment?
Okay. A lot of people think that you need to have an assessment before you can have therapy. That's not the case. Definition of therapy is a treatment intended to relieve or to heal a disorder. It's generally an hour-long session where you speak with your therapist about your mental health concerns or issues in your life, and they can help you through. Assessment is an evaluation using testing measures to determine a diagnosis and to give recommendations. Assessments have to be done with a psychologist as well as a psychometrist in our office anyway, to do the testing for them. Once the testing is completed, then scoring and data interpretation is done, draft report is written, and then we set a feedback, at which time you'll get a diagnosis and recommendations. Sometimes the recommendation, or oftentimes the recommendation, is to seek out therapy, but it all depends on what is found in the scoring and data interpretation.
Right. And I'm sure a lot of people don't know about the fees too, so that's probably something that they need to check in on before they go ahead and book.
Fees are definitely something that you need to discuss with your therapist, with the admin, whatever, before you go into an assessment.
Never good to have surprises like that.
No, definitely not. And I mean, they can be pricey. So you definitely want to make sure that if you have coverage, that the coverage will cover specifically the assessment as well.
That's a good point. Can you explain the difference between a registered psychotherapist qualifying, social worker, psychologist, psychiatrist, all the different ones?
Well, there's a lot of different types out there. So we'll start with, so psychotherapy is kind of like an umbrella term for anyone who does therapy. A psychotherapist, registered psychotherapist, they belong to their own college. They can work with individuals and families or families depending on their training. Then there's qualifying psychotherapists. So they're in the process of completing their clinical hours. They still have to write a final exam, though, to become registered. They are able to provide counseling services while under supervision. Then we have social workers. Oftentimes they've got a master's or a bachelor's degree, and they provide support to people with mental health issues as well. Depression, anxiety, PTSD are some of the issues that registered social workers can offer support with. They also belong to their own college, and they can work with different age groups depending on their training. At our office, everybody is kind of under the supervision of a psychologist, so social worker would be as well. So psychologists have a doctoral degree. They focus on emotional and behavioral aspects of mental illness using different techniques of psychotherapy. They can treat as well as they can complete testing to see if a psychological diagnosis is present, and they are governed by the College of Psychologists. We have psychiatrists who also have a doctoral degree, and they have the ability to diagnose patients through testing. Psychiatrists are also medical doctors, so they have the ability to prescribe medication to their patients. Essentially, if you need medication for depression, for example, you'd need to see a psychiatrist. However, you could see a psychologist or psychotherapist for treatment, and they can refer you to a doctor for medication if needed, or refer you back to your family doctor.
Okay, perfect. How do you suggest someone finds a therapist whose background aligns with their specific concerns?
Well, connecting with your therapist is really important. I would say to read the therapist bios from all the clinics around you. Be sure to read them and choose a few possibles. Then you can kind of narrow it down. Also, in an office where there's an admin, when you give your information, they can often match you up with the best therapist to fit your needs.
Okay. Might kind of just speed things up a little bit if there is someone.
It does, yeah. And once you're talking to somebody, you can get more of a feel as to what they need and kind of match up personalities too with the therapist, which is kind of nice.
Yeah, it's definitely helpful. So in that regard, what would happen if a client isn't connecting with their therapist? Would it hurt the therapist's feelings if they try to find someone new?
That's a really good question. Your therapist is going to have your best interest at heart. If there isn't a good connection for you, there probably isn't a good one for them either. So they would definitely want you to move on to someone else to help, or that will be able to help you. Just be honest with yourself. If things aren't working out, and start looking for someone new. It isn't beneficial to anyone if you continue seeing a therapist and you aren't getting anything from the appointments. It's best to just move on if the services aren't quite for you.
Right. And that would also just, if you do have coverage, it's just kind of a waste of your coverage if you're not actually getting anything out of it.
It absolutely is. Yeah, for sure.
Okay. What would happen if you share custody of a child who needs to meet with someone? What's that kind of process like?
So this can be tricky sometimes, but in cases of shared custody, it's preferred that both parents are on board with therapy for the child. Often in the case of younger children and adolescents, the therapist will meet with parents to get some background and to discuss possible treatment. Having both opinions is really helpful. If the parents prefer not to be together for the session, split session or 2 totally separate ones can be arranged. Fees would be charged for both sessions, though.
Right. Okay. So it's best just to be honest. Like if you don't get along with an ex and you don't think it's going to be beneficial, then just do it on your own.
Absolutely. Yeah. I mean, people usually try, like the majority of people try to put the best interest of the child first, but sometimes there's so many hurt feelings that parents just cannot be in the same room or even on the same computer screen. together, and we understand that, and we'll do our best to make everybody comfortable.
Right. And then it would be in the kids' best interest too if they know that, and then they can just do things separately.
Absolutely. The other thing that I should mention, with quite often adolescents aren't really on board with therapy. So make sure, if you're seeking out a therapist for your child, teen, whatever, that they really are on board. I usually tell people to have them read the bio with you to make sure that they think that they can connect with the therapist.
Right. They need to be open to actually talking to someone, because if you just
exactly
put a kid in a room, they're not going to just start talking to someone with no
for sure
desire to.
Yeah. Go in cold and I don't really want to talk to you. It's hard for the therapist as well too. It's like pulling teeth to get them to talk.
Oh, for sure.
Obviously, they're not in a place where they're ready to.
Yeah. Can you explain the consent process for if a child comes to see a therapist?
So legally, a child 12 years old and above can sign for consent for therapy. What we do in our office, we have both the child and a parent sign consent in order to rule out any issues when it comes to confidentiality and to billing. I mean, let's face it, these sessions cost money. You need to know the prices. Best thing to do is to ask your clinic or your therapist about procedures.
Alrighty, that makes sense. Also, with billing, can you explain the insurance process and just like how to tell if you're covered for a specific therapist and like that kind of stuff?
Sure. The best thing to do, obviously, if you have a handbook, look it up. If not, you can call your extended health benefit company to find out if they will cover, what type of therapist they will cover. We usually send out the wording. So it's like, for us, it's whichever type of therapist under direct supervision of Dr. Garcia in our case. But some will cover registered social workers, some won't. Some will cover psychotherapists, some won't. So it's definitely best to have a little conversation with them just to make sure that they will cover.
What is the difference between direct billing and submitting a claim to your insurance company?
So direct billing is where the office bills the insurance company directly. Not all offices do this. We don't. So you pay us after the session, and then you submit the claim yourself. So by doing that, quite often you can do it online. We'll send you a receipt, and you can just upload it directly to your insurance portal.
And then you had mentioned that the therapists in our office are supervised by Dr. Garcia. Can you just explain kind of what that means?
Sure. So the supervision is for insurance purposes, so extended health benefits cover. The other reason is so the therapist has someone to discuss a case with, find additional ideas, additional resources to help their client. It's always kind of nice to have somebody that you can bounce some ideas off, and to get some advice in helping with their treatment. It's also possible that they need a signature of the supervising psychologist for a form or a letter. Quite often it would have to be from a doctor. So the psychologist then would be the one to do, as well as the treating therapist. So the supervisor needs to know at least parts of the case before signing.
I think that's all the questions we had for today's episode. Thanks so much again for joining us, Brenda. You were definitely able to shed some light on a few questions that I'm sure many people have before starting their therapy journey. If anyone has any further questions about seeing a therapist at our clinic specifically, they can contact us through our website at www.capitalpsychological.com, or they can give us a call at 613-599-7709. Thanks so much for listening.